You guys seem to enjoy the healthcare assistant interview questions. So in this series, we're going to be going more in depth in the healthcare assistant interviews, especially for each module. We're going to be looking at each module of the healthcare assistant course and questions that are related to that modules. When interviewers are conducting an interview, they will ask you questions that are coming from each module that is in the healthcare assistant course. So it is good to have a knowledge and a good base of all the questions that you may be faced in an interview. In today's video, we're going to be looking at one of my favorite modules, which is the care of the older person module. If you have an interview, especially for nursing homes, then you'll find this video very informative, as if you have an interview for nursing homes, they definitely love asking a lot of questions. I would say in the interviews that I've attended, I've seen about 70% of the interview is questions coming from this module, because you are dealing with the elder person, so they really want to test your knowledge. Question number 1. What are the key principles of caring for the older person? The key principles of caring for the older person, including promoting independence, maintaining dignity, providing person-centered care, and ensuring safety and comfort. How do you promote independence in older people? Promoting independence in older people involves encouraging them to participate in activities of daily living, providing assistive devices and equipment, and supporting their decision-making abilities. This can be even little things such as suggesting to an older person that you're caring for and saying, "What would you like to wear today?" Giving them that choice to choose what they would like to wear. It makes the older person feel more independent and feel that they're included in their decision making as well. It can also be asking them what they would like to have for lunch, breakfast, or dinner, instead of just giving them what is available. Included in this is also when it comes to the daily care that you give an older person, asking them a question like, would you like a shower today, or would you like a wash today? What are the common age-related changes that affect the older person? Common age-related changes that affect the care of the older person include decreased mobility, decreased sensory function, changes in cognitive function, and an increased risk of chronic health conditions. Sorry to interject here, guys. If you're finding this video informative, then I would really appreciate it if you liked it. And if you feel like you'd like to watch some more of this, why not subscribe as well? It does my channel a whole lot of good. Now back to the questions. What are the different types of care that the older person may need? Older people may need different types of care, including personal care, nursing care, medical care, and support with activities of daily living. One of my favorite questions as well, how do you maintain dignity when providing care to the older person? Maintaining the dignity of older people while providing care involves respecting their privacy, using appropriate language, involving them in decisions about their care, and ensuring their physical comfort. This can be as small as making sure the door is closed before you start to provide care, making sure that blinds and curtains are closed during care as well, and making sure that the part of the body, if you're giving the person a wash, for example, that you are not washing at this time is covered, and only the part that you are washing at this time is uncovered. For example, you can cover the bottom part while you wash the top part, or you can vice versa as you continue to wash. This particular question, I've almost been asked in every interview that I have attended, so it's definitely an interviewer favorite. What is person-centered care, and how do you provide it to the older person? Person-centered care is a type of care that focuses on the individual needs and preferences of the person receiving care. To provide person-centered care, to provide person-centered care to older people, you need to understand their unique needs and preferences, involve them in decisions about their care, and respect their choices. What are the key factors to consider when you are providing care to a patient or to an older patient with chronic health conditions? Key factors to consider when caring for older people with chronic health conditions include understanding their condition, managing their medications, promoting their physical and emotional well-being, and ensuring their safety. These are some of the questions that you can face in a healthcare assistant interview question that are focused on the care of the older person. If you are looking for more healthcare assistant interview questions, then I've done a playlist which I will link over here and you can take a look at that. If you would like me to do a part 2 of the care of the older person and more interview questions as well, let me know in the comment section and I will gladly do that. Thank you for stopping by. Please like, share and subscribe, and I'll see you in the next video. Bye bye.